So, being the fourth, but also because we're talking around the same issues, it's clear common themes are coming across in our discussions as in some of those previous ones we've just heard about. So you're looking about how do we ensure that people get the same standard of care, the correct standard of care wherever they're seen. So next slide, please.
There is a remote, yeah.
Oh, okay. So when it came to the challenges, we came up with four. One is the lack of implementation of standards of care in countries, across countries and between countries. So there's inequity both, again, within and between countries. The problems of the lack of a skilled workforce to deliver those standards of care at all levels. The other challenge is how do we enable patients to be at the center of their care? And also a challenge that in the background there's a general low expectation of what can be achieved for RMDs and the importance of it, both amongst the public and health professionals, which generally keeps the level of provision of care at a low standard, low priority. So those were the issues in terms of elaborating upon them. So under implementation, lack of implementation, one problem is there's a lack of data on whether standards are actually being implemented across Europe and within countries. We don't have standardized audits being done. In one or two countries they're happening, but not in a consistent way to allow comparison. And then obviously you need to make that data available to people so they can see it. Then there's a problem with the workforce, which was come out of one of the earlier presentations, that we don't have an adequate workforce, and we've got to make sure that they're motivated in the right way and reimbursed in the right way, so it leads to good practice, not financially driven practice. And that's because of differences in the reimbursement systems that happen. In an earlier discussion, for example, I was hearing that in the Netherlands, physiotherapy is not reimbursed routinely, and so you can't therefore have the model of care which we would all expect for many conditions. We then consider the workforce and how do we make sure that the competencies of the workforce matches the patient pathway and the needs of the patient at all stages, from when they first present to someone with a musculoskeletal problem to make sure they end up going up the system, seeing the right level of expertise. How do we make sure that each of those professionals they see do have the right competencies? And we highlighted the big issue of inadequate training for non-musculoskeletal RMD specialist health workers. So for the GP, the average physiotherapist who's not specifically dealing with musculoskeletal problems, RMDs. And the other thing is there's a lack of good examples for mentorship. So if you want to actually show someone how to do it well, there's not enough knowledge about where it's good to go and see good practice. The next barrier was ensuring the patient is at the center, and some of these issues have been previously covered, the lack of data and access to that data so the patient knows where they can get good care, the health literacy of the public and patients to understand that information, and the general public and patient awareness about what can be achieved to know that they should be pushing for it. And the other thing which came out about from the patient being in control is to be listened to and it be recognized and valued when they say, I want a second opinion. That's either because they've got what is clinically viewed as a minor problem, but to them is a very severe problem because it's affecting what they're able to do, or they've got a rare condition and they just don't feel they have confidence in their primary health care service, the first people they're seeing. So ensuring that it is recognized that sometimes they do need to get additional opinions. Then around the low expectations, elaborating on that, as I've said, it's this lack of awareness of what can be achieved, lack of indicators to know what can be achieved, and the general non-expert medical attitudes to this group of conditions, not recognizing the impact it has on people and knowing what can be achieved. So in other words, people end up not going through the system with the appropriate urgency, and that's why we don't hit targets such as 6 weeks diagnosis for early RA. So when it comes to the actions we would recommend, one is at the EU level is for there to be professional standards, both medical and non-medical training and CPD. So it's not just training, but it's continuing education and ensuring ongoing quality of competencies, and also the standardized collection of indicators. And we feel that is at the EU level. Then at the member state level, it's requiring that there should be standards of care and quality indicators, and that they're collected, that the services provided match the patient pathway with an appropriate workforce to deliver them, and that reimbursement systems encourage appropriate care and not inappropriate care. Then for stakeholders, it's actually producing and implementing the evidence and sharing that best practice of how to deliver it. It's disseminating information to patients, including apps, to ensure that they have enough information to be in control of their care and involving patient organization to do so. And it's working with other stakeholders. And when we say other stakeholders, it means outside the classic RMD community, but other ones where there are perhaps similar goals where we can work in parallel together. Thank you.